My name's Pip, and I work for the NHS here in Northamptonshire. Thank you for taking the time to watch this film. Every year, an extra 27,000 people die in this country as a result of the effects of cold weather. They're dying from preventable diseases, or because they're too poor to heat their homes, or they can't get out to see their GP or get to hospital in order to get treatment. And then worst of all, there are those who are vulnerable, living on their own, and we just don't know anything about them. And so when the bad weather comes, there's no one to make sure they're okay. To try and combat some of these problems, the Department of Health have released the Cold Weather Plan for England, and it runs from the 1st of November all the way through to the end of March each year. Now let's first of all think, what's bad weather? You might be surprised. The definition's been given as an average temperature of less than 2 degrees Celsius for more than 48 hours, perhaps combined with widespread ice, or up to 4 centimetres of snow. Now for you and me, that could just be called winter. But remember, this is about vulnerable people, and this kind of weather, it's been shown, kills people. People such as the over 75s, for some reason particularly women, frail people, elderly people living on their own, those kind of people living with a chronic condition, a chronic medical condition, such as a heart problem or breathing difficulties or kidney or liver disease. Then those with dementia or with a severe mental illness or perhaps even just learning difficulties. Then there are the very young, the under 5s, those living in fuel poverty, that's spending more than 10% of your household income on just heating your home. And those that are living on our streets, those that are homeless. To give you an idea of the challenge in Northamptonshire, there are 48,000 people over the age of 75. We think there's about 38,000 people living on their own. Then 69,000 people living with a chronic medical condition. 44,000 children are under the age of 5. And we reckon about 47,000 people live in fuel poverty in this county. But on the whole, we just don't know who these people are. Now add into that, there are 36,000 people with a severe mental health condition, 7,000 people living with dementia, 10,000 people struggling with learning difficulties. And surprising to me, 19,000 people over the age of 65 struggle with daily activities you and I take for granted. Simple things like walking down the street, moving around their own homes freely, getting upstairs or downstairs, getting out of bed and getting themselves dressed without anyone helping them. These figures are staggering, which is where we need your help. We've produced a number of these cards. On the inside is the key advice the national plan says we need to be giving to people. It's obvious stuff. Simple things like, do you know the weather forecast? It's surprising how many people don't. They don't realise there's bad weather on the way and what it could mean for them. Then, have they got enough food in the house? Or if you know they're on medication, have they got enough of their prescription handy? If they can, they ought to get someone to go and help them. Or if you're able to, will you be willing to do it for them? It's highly likely that they're entitled to a flu jab for free from their GP. So please, just remind them. Say, have you had your flu jab? Surprising how many people, particularly vulnerable people, get ill with the flu during the winter period. Then there's some useful advice, which you and I probably already know. Simple things like, make sure you've got at least one room in your house warm. That's 21 degrees C during the day, which is 70 Fahrenheit in old money, and 18 degrees C or 65 Fahrenheit at night. Then wear several layers of thin clothing rather than one thick jumper. It's amazing how many people out there don't realise that's actually a warmer way of dressing. Then possibly most importantly of all, just make sure they've got someone to come and check on them. Have they got family and friends nearby? Or do they need to know their neighbours? And then think for yourself, when will you see them next? And if you know you're going to, let them know. All we're asking from people is that you take one of these and you think, every time you meet someone, are they one of these people? Because if they are, they're at risk from cold weather. Just make sure they know these few simple things. And if you can help them, give them these telephone numbers. We recognise that we're not going to be able to reach every single person, that some people are going to die. But with your help, you might just save someone.